Brought to you by Tiger Beeford.
Hello, my orthopedic tribe. Welcome to Inside Orthopedics. This is Tiger, your orthopedic industry insider and retained recruiter for early stage orthopedic companies. This is episode number 29, titled The Founder Effect in Orthopedic Startups. So each startup comes to life with given or specific strengths and weaknesses. No orthopedic startup is perfect in the beginning. All startups have great strengths that are early assets in the early years, and all have weaknesses that, if not addressed early, can become a weak link and can really stymie growth and execution for a startup. So think about it. We all hear about startups. Why do some reach profitability quickly while others burn cash year after year? Why do some run like a smooth operation like a Swiss watch while others live in chaos? Why do some have a great product but can't seem to get sales traction? So I'm going to share my thoughts about the founder effect in orthopedic startups. The founder is the person who starts the business and typically leads the business from the beginning. The founder's strengths end up being the founder's weaknesses. My thesis is that the training and background of the founder determines both the strengths and weak links of the company in the early years. This opinion is derived from decades of pattern recognition following hundreds of orthopedic startups. The founder only knows what the founder knows. Below, I'm going to share patterns that I see for each type of founder. Don't take these examples literally. I'm just talking about general tendencies and not specific companies. Okay, let's jump in. I've seen 7 different types of founders in orthopedics. Let's walk through all 7 founder types and dissect their inherent strengths and weaknesses. Okay, founder category number 1 is a sales and marketing background. Usually this person comes from an independent distributor or maybe a marketing executive from an organized orthopedic company. Their strengths: they are very close to the customer. They know how to build a distribution model. They have a practical understanding of what the customer needs. They're very strong in messaging to the customer. So what's the weak link for this founder? Weak link is unrealistic expectations for cash burn and timelines for areas such as product development, regulatory, and operations. Often poor understanding of manufacturing and timelines in order to make the product. Sales and marketing founders tend to build operational systems late in the game. So my advice for the sales and marketing founder is to hire strong operational leaders early. Here's a few examples that I've noticed out in the wild: Choice Spine, DGen Medical, Osseous, 4Web, Osteo Remedies, Extra Ortho, Into Bones, Sotiera, and Danik Medical. Okay, founder category number 2 is a clinical background. This person's usually an orthopedic surgeon working in a full-time practice. So what does the clinical founder strengths? Closeness to the customer and solving real clinical problems. That's a big one. What's the weak link of the clinical founder? They generally have unrealistic expectations of funding and timelines, again, for product development, regulatory, operations, and sales. Also, the surgeon's founders are often driven first by trying to impress their MD colleagues. Most want to continue their full-time medical practice, which is a problem. So my advice to the clinical founder is hire a CEO early with operational expertise to lead your company. Examples in the wild are Exactech, although they've been around a long time, Hand Innovations, IntelliRod Spine, Titan Spine, Mirus, Micro C, Aptus Medical, and New Ortho Surgical. Okay, founder number 3 has a technical background. This person's usually an engineer within a startup or an organized orthopedic company. The engineering founder has obviously strengths in product development, product detail, and all systems in general. The weak link for the technical founder is sales and distribution for sure. They don't really know what the customer wants and what he is willing to pay for. And occasionally there's an ego problem with this type of founder also. So my advice to the technical founder is to hire a marketing pro early, then hire a sales pro 9 to 12 months before commercialization. Examples in the wild are Taken Spine, Next Step, Regeneration Technologies or RTI, NovaProach Spine, Mission Surgical, and Medica. Okay, founder number 4 is Inventor of a Class 3 device pathway. So their strengths are they have big cojones. They are thinking big to carve out a huge regulatory barrier against potential competitors. They are not afraid of risk. They're in for the long haul. What's the weak link of the Inventor in Class 3? It's long haul fundraising. Since this is an 8 to 10 year project, time to market can be stressful for raising money each year. They're not asking the question, are investors willing to wait that long for commercialization? My advice for the Inventor on the Class 3 pathway is to hire strong clinical and regulatory leaders with some street smarts, some risk takers. Examples in the wild are Intrinsic Therapeutics, Active Implants, and Surgical Dynamics. Okay, founder number 5 is similar. It's an inventor on the Class 2 device pathway. So their strengths are IP protection of the product by far. This inventor's weakness is an unrealistic expectations of product and market acceptance. They think everyone will love my idea once it's a product, and they may not. My advice to the inventor on the Class 2 pathway is to hire proven engineering management and a marketing pro early. Examples in the wild are SpineWave, Ellipse Technologies, and Trans1. All right, founder category number 6 has a finance background. This person could be a finance person in a large orthopedic company or a VC or even a banker. The finance founder's strengths are cost control, maintaining profitability, and avoiding the need for outside funding. The finance founder's weaknesses are a lack of closeness to the customer and generally taking risks with new technologies, which often leads to low R&D investment. My advice to the finance founder is to hire strong sales and marketing pros early to complement yourself. An example in the wild is Wenzel Spine. Founder category number 7 is a team, usually a collection of 2, 3, 4, 5 individuals with diverse orthopedic backgrounds. There's many strengths that the team has. Ability to listen to the customer, validate the market need, deliver what the customer wants in a timely way. The team's weak link that doesn't show up in other founders is alignment. Sometimes the team will push and pull in different directions. Founders, investors, and key personnel can lose sight of shared goals over time. My advice to the team founder is the CEO must over-communicate and continually review the company's collective objectives. The example in the wild is Orthopedics, a team-founded startup. So that's it. That's all 7. I think you can see the strengths and weaknesses, and if you'll think about your favorite orthopedic company startup, you will actually see this yourself. So send me a note. What's your experience with orthopedic startup founders? That's it. It's a wrap. Hope you enjoyed the view from the founder perspective. As always, don't forget to subscribe and keep innovating, my friends.